And in terms of supplements generally, do you know, again, not to bring Mel into this for the 1,000th time today, but a couple of Christmases ago, I told her that she should be having creatine because all these people on my podcast told me it. And she said, no, it's for bodybuilders.
Yeah, that's the old school thought. When we're thinking about creatine and how it got its chops in the supplement world, we're looking at muscle performance, and taking 5 grams 4 times a day with some carbohydrate to enhance muscle performance is how it started. But when you start really disseminating down into the health aspects of creatine, creatine is used in every fast energetic of the body. So that means your brain, your heart, your gut, muscle, everything that requires energy from 0 to 30 seconds, creatine is involved. Women have about 70-80% of the stores of men. And when we start looking at all the different types of diets that are out there, lots of exclusionary food diets, and the intake of creatine is lower. What we're finding in the research from health perspective is that it does so many positive things when you're able to saturate the tissues to bring it up with even a small dose of 3 to 5 grams a day. Our liver makes about 3, but we don't necessarily eat enough to help supplement all of the tissues.
How much would it take? Like 12 chicken breasts or something?
22.
Okay.
22 chicken breasts. A lot. So when we look at the supplementation and being able to saturate all of our tissues thoroughly to support those fast energetics, we see things like better cognition, focus. We see a faster recovery from small brain traumatic, like a friend's daughter hit her head on the laundry door of the dryer and got a TBI or a small concussion from that, started using creatine, came out of it a lot faster. I mean, there are things that help with brain metabolism. We see women who have incidences with IBS or gut issues, and they're using creatine. It helps decrease the symptomology. We're seeing now studies coming out about fatigue, and this is where the 0.38 grams per kilogram of body weight, or the equivalent of 20 grams if you're 60 kilos, helps with fatigue and focus, especially if you're under a lot of high stress. Because if you're under a lot of high stress, your body's going through a lot of blood glucose trying to keep up with that stress. So creatine isn't just the bodybuilding set. There's so many different health benefits, and it keeps coming out with more and more research to show how beneficial creatine is.
Do you have to consider different supplements at different phases of life? We've talked about hormones, but if I'm an adolescent versus someone who's post-menopausal, should I be thinking about a different supplement stack?
So in our clinic, we first have them track their nutrition, and we look to see where the gaps are. Now, things like iron, I can easily get a blood test to tell you. Things like fat stored, like vitamin D is stored in the fat. So, looking at a one-time level gives you a pretty good idea of what their stores are. So 2 of the things that are pretty consistent are patients are struggling to get enough fiber in their diet. And so fiber is one of the things that we tend to recommend, especially if they are not a vegetarian or vegan, if they're really struggling through nutrition.
And what's fiber going to do for me?
Okay, so fiber has a lot of goals. So, it does 2 things in the gut. There's soluble and insoluble fiber. So soluble means it dissolves in water. Okay, and then insoluble fiber is the bulking agent in the stool. So you ingest it and it never leaves the gastrointestinal system, and you just carry it out, when you have a bowel movement. And so it pulls water into the gut. And so that's important if you're eating a lot of fiber and you're having a fiber supplement, that you are hydrating as much as possible, because it can cause constipation if we're not getting enough water into our system and we're bulking the stool up, but we're not adding water. So then constipation can be an issue. But that increases the transit through the colon, and people who have high fiber diets have lower risk of colon cancer. And so part of that is probably because high fiber diets are also high in lots of other things that are good for you, vitamins, minerals, nutrients. And so that decreases your risk of any cancer as well. And then soluble fiber feeds our gut microbiome. It is actually ingested by the bugs in our gut, which make up 50% of the weight of our stool. And that creates butyrates. And, when these bacteria are going through their enzymatic, their digestive processes, one of the byproducts of that are these butyrates, which are then rapidly absorbed into the bloodstream and are very antioxidant, anti-inflammatory. So,
could you give me the menopause supplement stack, if there is such a thing?
Okay, so in general, we're not going to cure menopause with supplements. Let me just take straight up, okay? Most women are going to be deficient in fiber, and most women are going to be deficient in vitamin D. And vitamin D is hugely important in multiple enzymatic processes in our body. And it's really hard to get enough through our nutrition, even eating stacks of salmon a day, which is really high in vitamin D. So about 80% of my patients are not only just low in vitamin D, they're deficient. So that is one that we can supplement safely up to about 4,000 IUs, international units is how vitamin D is measured, a day without worries of becoming toxic or having too much vitamin D, which is possible. And so usually I'm having creatine, absolutely. It's like a go-to. And we're looking at her nutritional profile. We're looking at her fiber intake, and then we're adding in a fiber supplement if she needs it.
Natalie, in terms of fertility, what
Yes.
is the fertility supplement stack per se?
Okay. First and foremost, we're going to say that if you are trying to get pregnant, which by asking fertility, we're going to presume, we want to make sure you have folic acid on board. So folic acid is the essential component, one very important part in cell division, but it's essential for a baby when it comes to brain development and spinal cord development. We call these neural tube defects. And the reason why I'm bringing it up is that there's a lot of chatter about folic acid out there, but it is the only supplement, folic acid in its folic acid form, that is proven to prevent these neural tube defects, such as your baby being born without a brain. And interestingly, in today's world, a lot of foods are also fortified with folic acid, but these are some foods that are often processed and people are consuming less. So we are having less consumption of folic acid in our diet, therefore making it even more important that we are supplementing with folic acid. As Dr. Haber said, vitamin D is essential for your entire body, but when it comes to hormone metabolism and fertility as well, we even see women who are going through IVF with donor eggs, and we know they're very good quality, have lower success rates if they have lower vitamin D levels. This is something that almost everybody is deficient in. We do test and then target treatment to try to get you to an optimal level. But also omega-3 fatty acids are really important in your entire body, but especially in your reproductive years if you might get pregnant. And I often recommend magnesium for most patients as well. And then from a fertility standpoint, if you have infertility, there are studies that show that coenzyme Q10 can be highly beneficial when it comes to egg quality. This is important in our mitochondrial health, and for the sake of the one question you asked, remember when we talked about eggs, we've got our genetic health, which is largely dependent on age.